This is my aunt, Fatma. In this picture, she is 49 years old, happy, healthy, has 4 kids, and holds tons of hopes for the future. Whereas in this picture, she is 49 and a half years old, sick, tired, nervous for future, and was diagnosed with breast cancer, despite the fact that she had regular breast screening. And she could survive only 6 months after this picture was taken. So the entire process was miserable, not only for her, for all of us around her. Like my aunt, many women all around the world suffers from this devastating disease. Breast cancer is the #1 cancer type among women. And the number of breast cancer patients even higher than the combination of other leading cancer types like colon or skin. And even more dramatically, every 8, 1 will be diagnosed with breast cancer during their lifespan. And it's a long-lasting problem. Almost half of these high-risk women are developed breast cancer in between 2 mammography. Let me take a step back and tell you the standard care of screening methodology at the moment. It is called mammography. And it is radiative, expensive, and very painful. And assuming your first mammography is clear, by the time you have your second mammography, it is already too late for some of these women. And they develop interval cancer in between, with a survival rate as low as 22%. Imagine with a technology which is non-radiative, attachable and detachable on your personal bra, you can increase the survival rate up to 98%. This is what we do. Our mission is to deliver on the promise of safe, non-radiative, and proven ultrasound science to create a wearable, attachable technology to enable early breast cancer detection for those high-risk women. And this is how our product looks like. It's a malleable, flexible ultrasound patch which can be laminated on your personal bra, and within sub-seconds, you can take the entire shape of your breast tissue without any skilled operator dependency and with no cold gel in between. And this technology can have this image and send to your phone, and from there to cloud, and you can process this longitudinal data monitoring and create an AI and machine learning report for the medical professionals. And compared to the current ultrasound technology at the moment, they are painful, bulky, and they require for you to go to the hospitals. But with this technology, not only we provide a wearable technology that can be used at home, which can be delivered to your doorstep, but also it is time efficient. Here the time equals the survival rate, and home-based, and 1 scan is less than a cost of a cup of coffee, compared to the $2,000 that the current ultrasonography needs at the moment. And this is the technology, how it looks like. It contains very tiny ultrasound beams, all connected with flexible and malleable interconnected wires, and placed on a dissolvable biocompatible polymer, which can be attached on the cup of your personal bra. And it can scan the entire tissue with 270-degree angle, up to 12-centimeter depth information, which is more than enough to find out the coordination and any tissue anomalies growing over time. So with this technology, with a profound resolution up to 0.02 centimeter, which is an order of magnitude lower than a stage 1 tumor size, and more frequent screening, literally every single day or every month or every week, depending on your case, we can enable early breast cancer detection, which is not possible right now. And why this is important? Only in US, 44,000 women lost their lives because of this devastating disease. Yet alone, insurance companies spend $30 billion for the breast cancer spendings. And with our technology, not only will it increase the survival rate dramatically, but we will also decrease the medical cost by half. So it's win-win-win situation for everybody who is involved in this journey. Currently, we train tens of clinicians at MGH. We partner with multiple doctors, and we have hundreds of patients are ready for the trials. We have the IRB approval, and we do all the intensive human trials at the MIT Center for Translation and Research, Clinical Translation Center. And we also have multiple government agencies supporting us. And we have a very strong IP portfolio, and we are also in touch with MIT CLO for the potential option agreements. Currently, we are on our way to establish profound relationship with leading cancer institutions like Dana-Farber and MD Anderson, and we will start this technology to try on high-risk women who have lower breast density, and then expand it to the high breast density, which cannot be captured by the mammography results, and then hopefully get the CE mark, go to Europe and rest of the world with a profound impact to save 12 million lives every single year. Currently, we are at the proof of concept. We finalize our proof of concept, and we get our first initial seed funding. And we are on our way to identify our CDMO and start with the pilot program, and then go on with the clinical trials, and hopefully within 3 to 4 years, we will have the FDA clearance and the company launch. We are currently looking for individuals who can guide and help us on the clinical studies to figure out the specificity of our technology, also for any expert connections for the FDA early discussions. And this technology was a dream on a piece of paper when I was staying with my mom during her last 12 days, just to try to comfort her at her bedside. But now it's real. I can touch it, you can touch it, and you can touch and save millions of lives. I believe the power in our hands to save millions of lives. Thank you.